Hi everyone and welcome to my channel. I'm Sonia, I'm an accredited health professional, and today we're talking about day surgery. Some of the things that you need to prepare beforehand, some of the things that you need to take with you, and what to have at home post-operatively. So if you like valid information, and I am a health professional, I've been working in healthcare for a long time now, then you need to subscribe to my channel. And of course, today is my own experience, so there are no references in my description box. You'll just have to believe me. So what do I prepare pre-op? So here are the things that you need to prepare before you come in. You should have already had a consult with your surgeon. So at that consult, you should have asked about any forms that needed filling, whether it's related to work cover or some accident that needs a quite detailed, or something for Centrelink or government support. So those things should be discussed at your consult with your surgeon, so that they're completed, or he knows that he needs, or she knows that they need to do that when you present at the day surgery unit. You also need to have organised a person to drop you off and to collect you. They must be a responsible person, so usually it's considered adult age, so over the age of 18. Also, you are expected, if it's a day surgery procedure, to be discharged home to somebody who is considered responsible. So if you don't have anyone at home, if you live by yourself, you may need to get a friend to come and stay over, a daughter, or go stay with them, because usually you need a person for 24 hours. So organise that before you come in. Also, ensure that you have your freezer. If you're having something like dental work, then you will need ice packs on your face. So definitely fill up your freezer with some, and make sure you have ice cubes. The same can be said if you're having maybe some plastic surgery somewhere, say your eyes, you'll need ice packs around your eyes and things like that. Definitely also ice packs for things like vasectomies. Men will need ice packs to place in their underwear to keep their area nice and cool, and reduce swelling for comfort. And definitely things like hot packs or heat weets for things related to gynae surgery, or where cramping can occur. And so things that actually help bring comfort are things like heat packs as well. So having them on hand at home and organised pre-operatively can be a really good thing. So apart from those things, what else do you need? Well, if you're a dental, then you're going to have to eat soft foods at home. So having those foods already in your kitchen cupboards, in your fridge, helps to alleviate the stress of trying to find something post-op. So definitely go looking for things like that, and realizing that when you have a general anesthetic, the peristalsis in your bowel and gut actually slow down. So thinking that you're going to have a big feed of, big steak and veggies that night after surgery is not a good thing. You're better off having something light and allowing your gut peristalsis to reactivate and give it time to, work through a few things. And that way it's not overloaded and you don't end up with constipation and discomfort as well. So the other thing is, often there are preps that we give patients to take for colonoscopies and things like that, and you can get quite dehydrated with those. So definitely having something like a sports isotonic drink, so that you can rehydrate quickly post-operatively, is a good thing. So in your fridge at home, so that when you come home you can have a big drink and all that sort of thing. Also, if you've been given specific scripts and instructions by your specialist or your surgeon, definitely go and get them filled. There might be antibiotics, there might be specific mouthwashes, specific creams. Whatever it is, make sure that you've gone and got them. because you don't want your person, whoever's collecting you on the day of surgery, to have to stop by a chemist in particular to pick up those drugs. Much easier if you've got everything sorted beforehand. It's called being organized. It makes everything really smooth. That's what we like. Smooth transitions from pre-op, day surgery, and post-op. Having something like simple analgesia, so these are things like oral paracetamol, ibuprofen or Nurofen, in your cupboard as well, because you may be discharged home with just those things to take that you already have. It doesn't necessarily mean, these are as therapeutic as some other drugs if taken as directed by your anaesthetist. You also would have fasted prior your admission, and if you're on antihypertensives or anticoagulants, you would have probably been told to cease your anticoagulants 2 weeks before or be on some specific regime rather than your anticoagulant tablets. So depending what's been organised for you there, your blood pressure or antihypertensives usually you take as per normal on the day of surgery. And it just means taking it with a tiny sip of water, and that way it controls your blood pressure throughout the day. But definitely just check with your anaesthetist or your surgeon pre-operatively. And of course, if you're asthmatic, bring in your puffers or whatever. And just if you're on a regular amount of medications, bring them into hospital with you, because the anaesthetist likes to know what you're taking. And sometimes you just can't remember, particularly if you're feeling a little stressed. So just a good idea just to bring them in so the anaesthetist can have a look at them, decide if anything's a problem or if he may need to give you something intraoperatively as well. What do I need to bring in with me? Well, a huge mistake people make is bringing too much stuff in with them. So when you come into a day surgery unit, you normally have given to you either a small locker space, like about that big, or you get given nothing. Your goods and clothes are stored in the bag you brought or a plastic bag and tucked under the trolley. So you need to wear the clothes that you come in. You will have shoes that need to go in your bag as well, so bring a plastic bag for those. And definitely, you want to bring things in like your paperwork that you need to for front desk or consents that have been signed. You will need x-rays that have been taken that are specific to your problem or whatever's been addressed. Sometimes the surgeon has them, but if not, you need to bring them with. You need to bring your Medicare card, your health fund card, and don't bring any cash or money with you. That's not a good thing because, of course, they're getting placed in a locker or they may be under the trolley and they're not necessarily safe and secure. However, this also applies to any jewellery. So, don't wear jewellery into a day surgery procedure. You will be taking it off and then you will have to find somewhere to put it. Much better to leave it at home where it's safe. Another good idea is to bring, something to read or flick through while you're waiting. So a magazine, a book, your phone and earphones so that you can listen to a podcast or something like that to keep you entertained while you wait. Because there is a little wait pre-operatively, and then of course, mainly post-operatively, you're quickly fed, watered, and leave the department. Now, what to wear? You're not going for a fashion parade. The clothes that you wear into a day surgery unit need to be appropriate for your procedure. So if I'm having a knee arthroscopy, do not wear skinny jeans because there's no way that you're going to be able to hoik those jeans up over your crepe bandage on your knee. So something that's loose fitting, easily able to put your leg in and out of, that has lots of room for a bulky crepe bandage. Okay, the same goes with anything abdo surgery, laparoscopic abdo, whether it's gynae or general surgical. The thing is there's a lot of bloating or retained gases in your abdomen. So anything tight on your stomach is going to be uncomfortable. So wear loose, comfortable clothing, preferably slip-on shoes because they're easy to put on and off. And remembering sometimes you're walking into the theatre and you will need to take your shoes off before you get into bed. So some of those things are good, and a plastic bag to pop them in and put back in your belongings is a great idea too. So that's just some ideas that you can have to what to wear. So I've gone through a few things of what you need to bring. Here is 2 don'ts. Don't wear makeup. I know. Guys, you don't have to worry. Or some guys wear makeup. I should take that back. But if you're wearing lipstick and, it makes it hard to see the perfusion of your lips, your lip colour actually is a sign of oxygenation, and staff actually look at that as well as their machinery to actually determine your perfusion level. And the same goes with your fingernail beds, okay? So many times patients have their nails and toenails done to come into surgery. And it's really hard to see brisk capillary return on their nail beds when it is actually beautiful, iridescent nail polish. So apart from the beautiful iridescent, not being able to assess perfusion of nail beds, it also makes it really difficult for monitoring equipment because those nail polishes reflect light. And that's what's needed to, obtain oxygen saturation. So just be aware of that. Everyone likes nice fingernails and things like that, but don't get them nail polished and, all nicely done so that you can come into hospital. Plain bare nails is what we like best. Yeah, just saying. Okay, some hints for different types of surgery are things, if you're having your eyes done, whether it's a cataract or whether it's a bleph, bit of plastic surgery there, some things that you will need to go home with are sunglasses, okay, because you're going to be photophobic, sensitive to light. If it's a gynae procedure, you will need to wear pads. So make sure you've got some at home, make sure you bring some in with you, and definitely have heat packs for at home. If it's orthopedic, make sure that your clothing is accessible to that part. If it's something to do with your hands or wrists, make sure that whatever you're wearing is easy to slide your hand through once it has bandages on it, or no buttons and all those sorts of things. If it's shoes, make sure they're comfortable, slip-on shoes, and you may need crutches as well to go home with. So if you have them, you need to bring them in. The other thing is if it's general surgical, things like hernia repairs, diagnostic laparoscopies, things like just loose fitting clothes around the abdomen are great. The other thing is if it's dentals, ice packs need ice and refilling, so you'll need ice at home. You'll definitely need lip balm, and you'll need soft foods for at home, and definitely mouthwash, whether you're going to make up salty water mouthwash or saline mouthwashes or by something like Cepacol is up to you and your oral surgeon. Things like plastics, so whether you're having any plastic surgery done, you may need ice packs, you may need special corsets or special shapewear. You should have purchased these prior to coming in, or special bras and things like that. So on the day of the surgery, what happens? Well, you'll come into the front desk, they'll verify your name or your details, collate your paperwork. You will then go and you'll see a nurse who will do a baseline set of observations. So these are your blood pressure, heart rate, temperature. And of course, during this time, you'll get asked a number of questions, weight, your height as well, and making sure that you have the consent, everything's good to go for theatre. You'll get dressed for theatre, which is usually a beautiful blue gown or white gown, a fancy little hat, some knickers. You're normally allowed to wear your own cotton knickers and maybe some socks to keep your feet warm. So that's also something that you can bring in with you. And then you will be waiting until you get taken into theatre. Once you have had your surgical procedure, you go to recovery. Here you are given pain relief, and everything is done to make sure that you're within normal limits in regards to your blood pressure and your pain relief and your wound dressings. Then you will go to day surgery, where you will eat, drink, and normally wee. And that is virtually your discharge criteria, to eat, drink, and pee. And then you will be given your discharge instructions, which tells you what to do when you get home, anything to take for pain relief, and when your next follow-up appointment is. And really, that is about it. That's your day. Just a little heads up, during COVID, you will be most likely asked to have a COVID test between 4 to 7 days before you come in. And then once that test comes back, you will be asked to self-isolate. Particularly here in Australia, this is what's happening. You don't have your surgery until you have a COVID test, unless it is an emergency procedure. So, and then of course, because you're in a public place, you will be asked to wear a mask throughout the whole hospital experience. So not much to ask really, if we're all doing the right thing. So that is what happens on your day surgery. I hope that's been helpful. And definitely, if you like information, subscribe. I'll see you next time. Bye for now.